The views expressed here are to be used for education or entertainment purposes and do not constitute individualized medical advice. Always consult a medical professional regarding your specific health needs.
It's common knowledge that having a positive attitude can, at least in some ways, improve your health, as well as your chances of achieving positive outcomes in the world. No, this is not the same as manifesting, though that's something that could potentially be discussed at a later time. And the converse is true of negative attitudes, which can potentially cause unhealthy physiologic states and poorer performance in the world. When it pertains specifically to how we respond to medical treatments, the effects of our positive attitudes are called placebo, and the effects of our negative attitudes, nocebo. Now, placebo is often viewed negatively, either as an inconvenience in medical research or as a pesky counter-argument against questionable therapies during heated disagreements. But at its core, placebo represents our capacity to create positive physiologic states within our bodies using only our mind, or in the case of nocebo, negative or undesirable states. Though typically placebo and nocebo refer to unconscious effects rather than the intentional application of positive expectations in order to improve our health. Now, placebo is a fascinating topic to me, and perhaps in the future we'll take a deeper dive into the degree to which our minds can promote healing and growth. But today we'll start with a brief introduction and try to address some common pitfalls in which we may incorrectly assign therapeutic effects to an intervention that are actually caused by placebo, nocebo, or other phenomena. We're going to look at some examples taken from one of my favorite Wikipedia articles. In these examples, we have a sick patient that's treated with either an experimental intervention or a standard intervention, or sometimes no intervention at all. We'll look at how our interpretations of the results of the intervention can be misleading, highlighting the need for thoughtful caution in evaluating the effectiveness of medical treatments. But what do I mean by intervention? Strictly speaking, an intervention could be almost anything. It could be strictly medical. For example, if you have a professional diagnosis, or at least a Google query, afflicting you with some rare and agonizingly fatal bacterial infection that you don't actually have, well, then the intervention could be taking some drug or some herbal supplement. But in a broad sense, an intervention is any experimental change that you make in your life for some expected but uncertain benefit. An intervention could be a kooky new exercise device. It could be electrically conductive bed sheets as an anti-inflammatory. It could be using manifestation to gain business opportunities or relationships. Or it could be a new training method to help you learn foreign languages while you sleep. So how do you know if an intervention that you apply to your life actually caused some positive result? Let's go over 5 scenarios that make that determination harder than we think it is. Scenario A is the misinterpreted natural course. In this scenario, our problem may resolve over time, whether we apply an intervention or not. But if we do apply some intervention, we may incorrectly attribute the resolution of our issue to the treatment rather than to the passage of time. The scenario can also be applied to recurring challenges. Sometimes pizza gives you acid reflux, sometimes it doesn't. Sometimes you're depressed, and sometimes you're not. Sometimes you're a god of war with 40 kills to 2 deaths, and sometimes your teammates are habitual laundry detergent drinkers. When we apply an intervention to treat a periodic problem, we run the risk of thinking that the intervention worked just because the problem didn't happen. But unless pizza gives me acid reflux 100% of the time, I can't be certain if the ginger extract that I'm taking is effective in preventing it. Now, over time, we can collect data to demonstrate whether an intervention is effective in reducing the frequency or magnitude of our recurring problem. However, this can take months or even years of data collection, and most of us are too impatient, or to be fair, too limited in time or money, to wait that long to come to a conclusion. And so we're encouraged to evaluate our interventions as effective or ineffective without sufficient information, often at risk of coming to an inaccurate conclusion. A slightly more complicated and more realistic scenario may be that we've applied an intervention, but we're not in complete control of our surroundings to the degree necessary to conduct a sound scientific experiment. Maybe I'm still dealing with that acid reflux, and I'm taking ginger extract, but I'm also traveling for work. If my symptoms resolve during the trip, I might be tempted to blame the ginger, the intervention, while the true cause may be some other unrecognized factor, such as a change in sleep schedule or diet brought on by my travel. This is a simple example of correlation versus causation, another topic we could discuss at length, but perhaps another time. Now let's move on to scenario B, the placebo effect. In scenario B, I'm applying some intervention to address a problem that I'm struggling with, but I'm also applying a large dose of hope. When my positive attitude is at least partially responsible for the improvement in my condition, this is called placebo. If an intervention is devoid of therapeutic value and is only effective when I believe it will be effective, I'm at risk of mistakenly attributing my positive results to the intervention rather than my attitude. Look, placebo is really, really well documented. It's the bane of drug manufacturers who often struggle to demonstrate that their treatments are both not the result of placebo and are also more effective than placebo. Because of placebo, the number and color of pills that you take can influence the sedating effect of that pill. Drugs to treat migraines, when labeled as placebo, are no more effective than placebos when labeled as drugs. Discount energy drinks impair problem solving compared to regularly priced ones, even when in reality they're the same energy drink. This is actually nocebo. Cough medicine is basically useless. Acupuncture is possibly useless. Antidepressants are also possibly useless. Drugs used to treat IBS or irritable bowel syndrome, you guessed it, also mostly useless, except when the patient knows that they're a placebo. Scenario C is the nocebo effect. Sometimes our expectation is that an intervention will cause a negative physiologic response. For example, I might expect that a vaccine will make me sick, or that a drug will cause side effects. When we experience negative symptoms, and those symptoms are either completely caused by, or at least amplified by, our expectations, this is called nocebo. Nocebo can also confuse the cause of treatment outcomes. Let's say I take a prescription drug to treat some medical condition, but I'm pessimistic that the drug will help. My negative attitude may interfere with the functionality of the drug, and as a result, my condition may not improve. Now, we can discuss whether a drug that gets turned off just because the patient is suspicious of it is worth the undoubtedly expensive prescription. That's another topic. Anyways, I might then decide to try an alternative herbal supplement, and perhaps I'm more optimistic about the safety and efficacy of this treatment. In some cases, my positive attitude alone may cause my condition to improve. While it's great that at least I'm feeling better now, things become tricky when I try to evaluate why my condition improved. Was it true that the drug was ineffective and that the herbal treatment was effective? When placebo and nocebo can affect intervention outcomes, this question becomes difficult to answer without thorough scientific study. Some examples of nocebo. Gluten sensitivity. Some research suggests that nocebo is partially, but not completely, responsible for gastrointestinal effects of gluten consumption in those who suffer from NCGS, or non-celiac gluten sensitivity. MSG. Despite the common myth, monosodium glutamate has been demonstrated to have no effect on headache or triggering asthma when consumed in reasonable doses in food. Penicillin allergy. Up to 20% of the U.S. population believes they are allergic to penicillin, but only around 1% or less actually is. And if you are allergic, it's been shown that your allergy reduces over time following an exposure, so you may not be allergic in the future. Electromagnetic hypersensitivity to man-made electric fields from things like power lines, Wi-Fi, and cell towers. Side effects from placebos labeled as drugs. Side effects from vaccines. Whether or not you experience side effects from your annual flu vaccine may be influenced by your expectations. Yes, this can apply to the COVID vaccine as well. Wind turbine syndrome. Generally the belief that infrasound or low-frequency sound produced by wind turbines can cause tinnitus, migraines, memory problems, and sleep disruption, or even cancer, sometimes at great distances from the turbine. Because wind turbine syndrome has not been demonstrated scientifically and lacks scientific plausibility, any such symptoms are likely to be caused by nocebo. Scenario D is no adverse effects. Modern medical drugs are highly targeted towards specific physiologic effects. As a result, many of them do their thing really, really well, but they also have nasty side effects. Alternative medicines, like chiropractics, acupuncture, and herbal medicines, have a long history of use but typically lack the potency of modern drugs. As a result, though, they also often lack the side effects. The philosophical and functional clash between conventional and alternative medicines is another fascinating topic, but perhaps one to be discussed in detail yet another time. The distinction between the two is notable for this discussion, though, because when we swap a conventional drug for an herbal extract, for example, we may feel better because of a reduction in side effects, while the treatment of our problematic condition may actually be impaired. This is especially difficult for conditions that lack definitive symptoms, like high blood pressure or cholesterol. In these cases, it can be difficult or impossible for a patient to know if an alluring alternative treatment with fewer side effects is effective until they receive medical diagnostics. Some examples falling under this scenario: medications to treat high blood pressure, like amlodipine, lisinopril, and metoprolol. I'm not a medical doctor. I'm assuming that pronunciation is correct. Anyways, so these can have side effects, including edema, dizziness, fatigue, nausea, and drowsiness. Alternative treatments for high blood pressure, like garlic, ginger, cinnamon, hibiscus, and green tea, may have more modest effects in controlling blood pressure, but they also won't have the side effects. Or, for example, chemotherapy drugs, which can have nasty side effects like suppression of the immune system, nausea, diarrhea, hair loss, anemia, and many others. Turkey tail mushroom has become popular as a potential natural cancer treatment, and patients experimenting with it, especially if they decide to discontinue chemotherapy, may feel better due to the reduction in side effects, but with no guarantee that the mushrooms are as effective or more effective in treating the cancer than the chemotherapy was. Or, for example, statins, which are used to treat high cholesterol. These can have side effects including joint and muscle pain, indigestion, and, just like almost everything else it seems, nausea, as well as more serious complications at a much rarer rate. Dietary changes may be effective in controlling blood cholesterol levels without the side effects of prescription drugs. For example, ensuring that you're consuming sufficient dietary fiber, reducing saturated fats, and eliminating trans fats from your diet, or supplementing with omega-3 fatty acids. However, blood lipid testing is critical to ensuring that such dietary changes alone are sufficient, since high cholesterol typically won't present immediate symptoms to indicate that an intervention isn't working. Now, these examples aren't meant to discourage you from considering alternative treatments. Rather, such treatments should be subjected to evidence-based evaluation just as any conventional treatment would. If I'm trying to reduce my blood pressure but don't want to take a conventional prescription drug, then maybe it's worth considering something like garlic or hibiscus tea instead. However, I should continue to monitor my blood pressure to verify the effectiveness of whatever treatment I end up trying. It also bears repeating that health and medicine are extremely complex subjects, and seeking professional guidance is preferable over taking advice from search engines, LLMs, or random people on the internet, like me. Moving on to Scenario E, this is interference. Now, sometimes because of urgency, we may apply multiple interventions simultaneously to the same problem, hopeful that at least one of them will help. However, in some cases, one intervention can interfere with the effectiveness of another. This can be a really easy situation to fall into. Maybe I've been diagnosed with some condition that I need to urgently take control of, so I've been prescribed a drug to help with it. But I don't like the idea of taking a drug every day, or maybe it has unpleasant side effects. But I might also be afraid to stop taking it. So instead, I add a second intervention on top of it, like an herbal supplement, hoping that it controls my condition sufficiently that I can stop taking the drug, or at least reduce my dose. However, if my herbal supplement reduces both the efficacy and the adverse effects of my prescription treatment, I may incorrectly assume that it's beneficial, again, especially when my condition is relatively asymptomatic. Consider St. John's wort, which is often used to treat depression and anxiety, but is also known to interfere with some other medications, including immunosuppressants, anticoagulants or blood thinners, and birth control pills. St. John's wort may also reduce the side effects caused by some chemotherapeutics, while also possibly reducing their effectiveness for cancer treatment. Also consider drugs used to treat HIV/AIDS, like ritonavir and saquinavir. A possible side effect of these medications is high blood cholesterol. Now, garlic may interfere with the effectiveness of these medications, which is detrimental for the treatment of the viral infection, but it may also result in improved blood cholesterol levels. Or, we can step away from medicine for an example, and let's say I want to learn a new language. I can buy some expensive training software, but maybe I find the process a bit challenging and stressful, and this causes me to be demoralized, and it kills my motivation. So what if instead I get the genius idea to ask ChatGPT to help me learn the language? I might find this to be a fun diversion. I might pride myself in finding an innovative solution, but maybe ChatGPT isn't the best at giving me critical feedback, so my learning actually slows, even though I'm feeling better about it. I've certainly noticed in my own use of ChatGPT that the tool is often overly agreeable and, as we all know, blatantly and confidently wrong at times. Or let's say I'm trying to lose weight and get in shape. These are kind of two different goals, but we'll just combine them together for now. Let's say I'm intrigued by the idea of a juice cleanse or a fruit detox where I only drink water and juice or eat fruit a couple times a day, and that's it. This is basically almost fasting. Now, I might see dramatic weight loss during this time, but that loss may be mostly water weight and thus not actually correlated to fat loss. For example, depleting stored carbohydrates as glycogen results in water loss, as that glycogen stored in the liver holds water with it. And the low sodium intake associated with a fruit or juice cleanse, as well as the diuretic effects of some fruits and vegetables, will also promote water loss. As a result, when I resume my regular diet afterwards, all of the weight I lost may rapidly return. In this case, the fasting or cleansing treatment is interrupting a more conventional healthy diet plan, like increasing intake of vegetables and healthy proteins and fats, and consuming fewer calories than I expend. So we've talked about many examples in which conventional drugs are being evaluated against alternative treatments. And this is a relatively straightforward paradigm for comparing a standard treatment to an alternative one. But in a broader sense, the same principle can be applied to any problem we're trying to solve, medical or otherwise. We know that correlation is not causation, but thoroughly elucidating cause and effect is tricky in practice, especially in our everyday lives when our objective is simply to apply an intervention to solve some problem we're facing and then to figure out if it worked and thus deserves continued expenditure of our precious time and money. In most of these scenarios, we simply want results. These are not scientific experiments. These are case studies performed on ourselves, n=1, often with no control treatment or any real data collection more precise than a subjective feeling that it worked or didn't. And even when there's clear evidence that our situation has changed, either for the better or the worse, establishing causation is often impossible without a thorough scientific study. The point is not that we should become paralyzed in the face of uncertainty, but rather to recognize when we have sufficient information to come to a conclusion and when we do not. Sometimes it's okay, or even necessary in instances of insufficient information, to simply conclude, for example, that my situation improved, while resisting the temptation to additionally claim that my situation improved because of my intervention. Embracing uncertainty often means accepting the what without misunderstanding the why.